Knock, knock, Mr. Baldwin. Hi, I'm Michaela. I'm going to be your nurse today. How are you?
Hi, I'm good.
Excellent. Mr. Baldwin, what I'm here to do today is to perform a head-to-toe assessment on you since you're coming from post-operative to our med-surg floor, okay?
Okay.
What that means is we're going to check everything from your head to your toes and make sure it's in working order. Sound good?
Sure.
Excellent. And before we begin, Mr. Baldwin, I need you to do is show me your wristband here. Tell me your first and last name and your date of birth, please.
Nick Baldwin.
Okay.
November 23rd, 1985.
Excellent. And then, Mr. Baldwin, what do you prefer to go by?
Nick.
Okay. And Nick, do you have a preferred pronoun?
He.
He. Excellent. And Nick, next thing I'm going to do is I'm going to ask you a series of questions. They're going to probably sound silly, but it's just to assess your cognition, okay?
Okay.
So first and foremost, do you know where you are right now?
At the Avidia Health Center.
Okay. Do you know what day of the week it is?
Tuesday.
Tuesday. Do you know the month?
April.
Do you know the year?
2020.
Okay. And do you know who our current president is?
Trump.
Excellent. Alright. Well, Nick, first things first, I'm going to grab my pen light, okay? And I'm going to check your eyes and see if your pupils are responsive. So you're going to see a bright light going through your eyes here for a minute. Let me take a look at them first. They're nice and numb, about 4 millimeters in size. Fantastic. Decrease. Perfect. Sorry if I blinded you there for a second. You should see any spots, anything?
Yeah.
Excellent. How's your hearing? Can you hear me okay?
Yes.
No hearing aids. Do you wear eyeglasses, anything like that?
Just reading glasses.
Reading glasses? Okay. How are your teeth? Can you smile for me? No dentures, no nothing like that?
No.
Perfect. Can you open up nice and big and stick out the tongue and say, ah? Okay. Perfect. No pain in your mouth?
No.
And you're able to swallow okay? Everything's going down fine with your diet?
Mm-hmm.
Okay. Perfect. So next thing I'm going to do is I'm just going to check your IV site. See there's no signs of infection, no pain, it doesn't hurt?
No, it doesn't hurt.
Okay. I'm just checking your radial pulses to make sure that they're present. Everything's looking good. Fingernails are nice and clean. Good capillary refill. Nick, do you mind if I remove your blanket? I'm going to just check your lower extremities here. Let's look at the back. Perfect. Nice and strong. No pain or discomfort in your lower extremities, especially your calves, nothing like that. Perfect. Toes are nice and clean. And then, Nick, what I'm going to have you do is I want you to push your feet as hard as you can like you're pressing a gas pedal. Perfect. Any pain or discomfort there?
No.
Alright. No edema, no swelling. Have you been up and ambulatory since your surgery?
Mm-hmm.
Okay, good. We'll keep that going. I don't see any redness on any of your body prominences. Alright, Nick, I'm going to have you ask you to grab my fingers as tight as you can. Perfect. Nice, equal, and strong. Excellent. Alright, next thing we're going to do is check your lung sounds, Nick. If I could have you sit up for me, please. Feeling any lightheaded or dizziness?
No.
Okay. Have you had any coughing since you've had your surgery?
No.
And have you had any, you've been doing your deep breathing exercises and your inspective spirometer?
Mm-hmm.
Perfect. Alright, for checking lung sounds with our stethoscope, where we are checking are between C7 and the 10th rib. We start at the top, basically just below the neck, in between the shoulder blades, and we end around the base of the lungs down here. So we have 8 points that we would hit. We would have 1 here, 2, 3, 4, 5, 6, 7, and 8. all with varying lung sounds. Each of those would be with a deep breath in and then the patient exhaling out. We'd be listening for wheezing, rales, rhonchi, anything that would sound abnormal. For Mr. Baldwin here, his lung sounds are nice and clear. Perfect. Now, Nick, I'm going to have you lay on your back again, and I'm going to check your lung sounds from the front. Perfect. Lung sounds from the front. If you have your stethoscope, you'll be checking right under the clavicle. So you'll have one here and here. You'll be going a little bit lower here and here, just to be making sure the frontal airways are nice and clear. And everything's sounding excellent. Nick, how are you feeling? No
Good.
lightheadedness, no dizziness?
No?
Okay, perfect. Now we're going to check your heart if that's okay. So I'll take my stethoscope and I'd go the mid-clavicle line and the fifth intercostal space on the left side to listen to his heart. We'd be listening for rate, rhythm, and S1 and S2, making sure everything's in order. Nick, your heart is sounding nice and healthy. From there, we'll be moving to his gastral area. We'll be checking bowel sounds for a full 5 minutes. In the 4 quadrants, we'll be assessing his surgical site, making sure that there's no oozing, that the incision's looking well, taking measurements of the skin, and replacing the dressing. Everything's sounding fantastic in your abdomen. How have your bowels been?
Fine?
Yeah, regular, no constipation, diarrhea, bloody stools.
No, it's regular.
Perfect. How many times a day do you think you're going?
Once?
Once a day? Okay. And are you passing gas?
Mm-hmm.
Good. And then how's your urination been? Are you drinking enough fluids? How's your urine look?
Yeah, it's looking fine.
And now, Nick, I know you're lying here. Are there any points on your body, like where your elbows are, your shoulders, your ankles, anything that's causing you discomfort, like you feel like you need a pillow?
No.
Okay, good. Perfect. All right, well, Mr. Baldwin, I have completed your head-to-toe assessment. Is there any questions that you might have for me?
No, I think I'm all set.
Okay. Would you like your blanket back?
Yes, please.
Mr. Baldwin, here is your call light. If you need me, just press the top button and I'll come running. Otherwise, you have a wonderful day.
Thanks, you too.
Now that our assessment is complete, it is important to take our findings and do proper documentation. As we can see, our patient, Mr. Baldwin, was expected the typical findings for the healthy adult post-operative. No edema, no fluid in the lungs, heart sounds were sounding great, incision was looking good on abdomen, bowel sounds were present, gas was coming, bowel movements were regular, urine was fine, all pedal pulses were present, tibial and radial, everything was in working order. Neuro checks were good, no issues there, no complaints of pain or discomfort. It was a perfect assessment. Take care. Thank you for joining. Bye-bye.